what kind of food or diet would you recommend to people to prevent or avoid diabetes, and for someone who's already suffering from diabetes?
Eat meals at regular intervals. Don't have a gap of more than 3 to 4 hours between your meals. Do not skip meals. If you're a diabetic and you're having a meal at 1 p.m. every day, make sure those timings are maintained. The amount of carbohydrates that you have at every meal, if today you're having one roti, every day it should be one roti. Or if it's two, then every day make sure you're eating two chapati.
Hello everyone, I hope you all are doing well. India has the second highest population in the world, whereby International Federation of Diabetes has estimated that more than 85 million adults in India are living with diabetes, and that is in 2021. This number is on constant rampant, and it's a very alarming figure. Every 14th of November is marked as World Diabetes Day. This is to sensitize people on prevention and care for diabetes. The theme for World Diabetes Day is Access to Diabetes Care. Millions of people living in the world do not have adequate support and access to diabetes care and treatment. It is very important for people suffering from diabetes to have adequate access to care and support for the ongoing support on their clinical condition and to prevent any further complication. It's always said that prevention is better than cure. Today, we are going to have an interesting interaction on our podcast because we have the founder of Neha Nutrifit, clinical dietitian Neha Chheda with us. She has completed a post-graduation in dietetics. She has worked with some reputed hospitals like Leelavati, Hiranandani, Kambala Hill Hospital and Heart Institute. She has worked with many fitness centers and NGOs. She has done numerous workshops where she has spread her knowledge to masses. Diet and nutrition has been her passion. Let me welcome Neha Chheda on yet another podcast of Neha Nutrifit. And let me tell you that you are one of my mentor, and I'm glad that you are here on the podcast.
Thanks, Bhavesh, for inviting me for this podcast. On your persistence, I'm here to spread the awareness of diabetes. It's my honor to be here with you today.
It's our pleasure, ma'am. So Neha, I have seen miracles with your diet for the members who have been suffering from diabetes, obesity, and many clinical disorder. I thought that no one could be better than you to speak about diabetes care on this occasion. So Neha, coming to diabetes, can you tell me who are more prone to catching up diabetes?
There are various factors which may lead to diabetes. I'm going to name a few of them. Genetics. So basically, people in blood relation who have diabetes, their siblings or children are more prone to diabetes. Obesity. People who don't have an optimal weight and are obese, they are more prone to diabetes, especially type 2 diabetes. Polycystic ovarian disease. Females who are suffering from polycystic ovarian disease are more prone to diabetes.
Okay.
Even gestational diabetes. So, while a lady is pregnant, after the 24th week of pregnancy, they might get gestational diabetes. Though this diabetes goes away as the baby is delivered, but in their later life, they are more prone to type 2 diabetes. Metabolic disorders like hypertension, dyslipidemia may also cause diabetes. So these are a few factors which may lead to diabetes.
So considering these factors, what I understand is it's more of hereditary, and second is the important point about gestational diabetes. So I think for women, there are two stages in their life. That is, one is menopause and other is pregnancy. So coming to gestational diabetes, I think women need to be taking more care, especially when they are pregnant. And postnatal care is again utmost important. And along with that, definitely everyone needs to be very careful about their food, lifestyle, and exercise.
Yes, Bhavesh, you're right. But this does not mean that men are not predisposed to diabetes. Lack of physical activity is another factor. So women as well as men definitely need to be taking care
I
of
totally
their
agree. I
lifestyle.
totally agree with you. So, Neha, coming to another question, what are those symptoms and what are those diagnostic tests which are important for diabetes?
Sure. I'm going to name a few symptoms which can help you recognize that you are in the early stage of diabetes or you are prone or heading towards diabetes.
Okay.
Polydipsia, that means excessive thirst. Polyuria, frequent urination than what you would generally do usually.
Okay.
Polyphagia, when a person feels more hungry than routine days, that's a classic sign of you are heading towards diabetes. Irritability or mood swings, feeling weak or tired, you should get yourself tested for sure.
And what are the diagnostic tests which are available or important to determine whether you're diabetic?
Test 1, get your fasting plasma glucose test done. That's a test which is done after 8 hours of fasting and not consuming anything for the last 8 hours.
Okay.
Postprandial glucose test, that is a blood test which is done post 2 hours a meal.
All right.
HbA1c, commonly known as glycosylated hemoglobin. That means your 3 months average blood sugars gives you a classic sign of whether you are diabetic or not. There's another great test that's also generally done, which is called as oral glucose tolerance test. So when your fasting diabetes or your postprandial blood sugars have come on the borderline, then the oral glucose tolerance test is done, which would tell you whether you're heading towards diabetes or not.
So, this is quite a bit of information that people should be aware of. And especially in country like India, even in my previous podcast, I'd mentioned that Indians are not very aware and particular about getting themselves tested or, going for those routine checkups. So at regular stages of their life, I think it is very important that one should go for such blood tests which are recommended by any medical professional. The whole idea is getting it detected early, or even if something which, with the test parameters are somewhere near the border, I think it can be prevented with a good diet and exercise. So again, prevention is better than cure.
100%.
So I'm sure, so this information on the blood test would definitely help to, diagnose if you are nearing to diabetes. So Neha, a lot of time we hear about blood glucose and insulin. So can you elaborate more on this? What is blood glucose and what is all about insulin?
So basically, I'm just going to simplify this so everybody can understand and
Sure.
not make it tough for all. When one consumes carbohydrates, it gets converted into sugars. When the sugars are digested, the pancreas realizes a rise in the hormone insulin.
Okay.
So basically, the insulin is a hormone which regulates blood sugar levels. But however, in diabetics, due to lack of insulin, the generation of insulin does not happen or insulin resistance.
Okay.
It prevents the utilization of glucose, which results in hyperglycemia or hypoglycemia.
So that's why, a lot of time we hear about people speaking about there's a spike in insulin.
True.
All right. So again, to combat that, what is the best solution?
So basically, when the sugar rises high, you make sure that you are maintaining a good diet and lifestyle as a long-term treatment.
Okay. Also, one more thing which, is a matter of concern, it's about juvenile diabetes. A lot of time, we have heard about juvenile diabetes and parents are really concerned about this. Can you highlight more on this?
Sure. Bhavesh, in my practice of last 13 to 14 years, I see so many parents getting their kids to us
Yes.
for juvenile diabetes. It's really disheartening to see that
I know.
parents restrict the child. Don't have a chocolate. When you go to the birthday party, don't pick up the cake. It's so much the child is supposed to enjoy at this age. But unfortunately, the juvenile diabetes is at a rampant increase in India. So, juvenile diabetes, also commonly known as type 1 diabetes or insulin dependent diabetes. So,
Okay.
basically, the pancreas is unable to generate the hormone insulin. So, this generally happens due to genetic factors or a couple of viruses. However, the insulin is a hormone which is used by the body to allow the blood sugar levels to enter into the cells to produce energy, which in juvenile diabetes does not happen. So, the treatment or the line of management for juvenile diabetes is one obviously cannot get out of insulin because this kind of diabetes is insulin dependent. So, a good diet, a healthy lifestyle, and maintaining your blood sugar levels is the best line of treatment for juvenile diabetes.
And I think parents should also make an effort that the children should be active, because nowadays sedentary lifestyle is the biggest problem amongst children. A healthy food and diet, which is equally important, because a lot of children we see nowadays having junk food, and even when we talk about healthy food, I think that awareness amongst children is very important.
True.
So, Neha, another important thing is I've seen a lot of people suffering from diabetes, and at times they become a little careless or carefree, and they would say कि चलो मैं ये अभी स्वीट खा लेता हूँ या मैं कुछ रॉन्ग चीज़ खा लेता हूँ और बाद में मैं गोली खा लूँगा. So this is for those kind of people. Of course, I'm not trying to scare them, but it's about being aware and cautious. So can you highlight few complications which are associated with diabetes?
So the complications are divided into short-term and long-term complications. The short-term complications include hypoglycemia. That is, the blood sugar generally goes very low, and this mostly happens at night when the patient is asleep and the patient does not realize it.
Okay.
Second is ketoacidosis. This is a metabolic disorder caused due to hypoglycemia. This generally happens due to insulin deficiency. The long-term complications would include cardiovascular diseases. So patients who are diabetic are more prone to basically cardiovascular diseases. This could also cause myocardial infarction, in common words a heart attack. It
Okay.
would also cause clogging of arteries. The second long-term complications would be nephropathy. So basically, diabetic patients have a very sensitive filtration of the kidneys. So they are more prone to kidney disorders as well.
Okay.
Retinopathy. So when the blood sugar level rises, there is a little infection that happens in the tiny little blood capillaries, which would cause a blurry vision or sometimes even blindness. Nerve damage. A spike in the blood sugar levels would generally cause nerve damage. So this could be also, we could realize this, when you get a tingling sensation in the thumb, or there would be numbness when you sit for a longer time. So this is also that your sugar levels are not up to the mark.
So what we understand is diabetes indirectly is associated with lot many complications. So it is very important that first of all you think about prevention, and in case someone who already has diabetes, kindly make sure that you take care of it and you do not let progress it into more complication. So coming to this, Neha, one most important question which I have and many people would have, is there a cure for diabetes?
Barish, so like I told you, there is type 1 diabetes and type 2 diabetes. So type 2 diabetes definitely has a cure, and it is reversible through diet and lifestyle. Like diet is the best medicine for any disease.
Absolutely.
But as far as type 1 diabetes is concerned, all that one can do is make sure you control the blood sugar levels, but you need to be insulin dependent. And the management can be done again through healthy diet and lifestyle management.
Many a times when I'm in a social or a couple of my friends, they keep telling me that diabetes is hereditary in my family, and they would just get paranoid, even if they don't have diabetes. They would keep thinking that अरे मेरे grandfather को था, father को है, मेरे को भी होगा. So basically a lot of times they have it in their mind that diabetes is something which is like a hereditary problem. So how true it is, and up to what extent hereditary diabetes running hereditary in the family, the chances of that coming to the family member, and what are the possibilities of prevention for that?
Basically, when you're imbibing something and you feel, oh, hereditary, may I have diabetes and I might get it, you are eventually imbibing, and even if it's not going to happen, it definitely happens. Yes, do not let your sleeves loose. Make sure that if there is a hereditary in your family for diabetes, you definitely take care, but don't keep imbibing it. As far as the precautions that one can take care to make sure that you do not get diabetes, I'm going to name few very important points which you need to take care of. Make sure that you're eating a healthy diet, exercising regularly, maintaining an optimum weight, and sleep well. If you take care of these factors, you definitely can make sure that even if you're going to get diabetes, it can be prolonged.
And I think also important thing is going for regular checkups. So you keep a check on your parameters. So even someone who's nearing a borderline, parameters which are related to sugar or insulin, one can take an action and make sure that we can prolong or prevent it. So, it's said that you don't need to pop a pill when you make food as your medicine. So, Neha, the last question is that what kind of food or diet would you recommend to people to prevent or avoid diabetes and for someone who's already suffering from diabetes?
Few important tips. If you follow that, you can definitely make sure you are at par from diabetes. Eat meals at regular intervals. Don't have a gap of more than 3 to 4 hours between your meals. Do not skip meals. If you're a diabetic and you're having a meal at 1 p.m. every day, make sure those timings are maintained. The amount of carbohydrates that you have at every meal, if today you're having one roti, every day it should be one roti. Or if it's two, then every day make sure you're eating two chapatis. Make sure you're consuming foods with a low glycemic index. Now, what exactly is a glycemic index? And very important term. Glycemic index basically means how fast your blood sugar rises due to consumption of a particular food. So, low glycemic foods would include legumes, complex carbohydrates like whole wheat grains, and cereals. There are also a couple of fruits which are divided into high glycemic and low glycemic index foods, which you can read in the caption. Make sure you're consuming a good composition of carbohydrates as well as proteins. Meat, lean meat, is a very good source and a complete protein. Make sure you substitute your high fat dairy products with low fat dairy products. Taking these small little steps will definitely help you prevent diabetes.
So, coming to this point, many of us feel that fruits are healthy. And as Neha mentioned about the glycemic index of every food item, I suppose foods like watermelon or mangoes would have a higher glycemic index. So when people think that fruits are healthy, but maybe a certain fruit would not be really healthy or advisable for someone suffering from diabetes. And this is what is all about when we are talking about diabetes or awareness on diabetes on this occasion. So the most important thing is that people should be aware of what is causing diabetes. If someone already has diabetes, how do we take care of it, and how do we not make it more complicated further? And in order for this, that you approach a certified clinical dietitian or an expert, or there is a lot of information online about diabetes, but make sure that you take an action, and let's make sure that we always try to prevent something which we can, and maintaining a healthy lifestyle, a good diet, and exercising regularly will take care of most of our problem. Neha, we had an insightful talk about diabetes awareness. And do you have any message to the audience on this occasion?
Yes, make sure that you do your diabetic screening on a regular basis. If you face any of the symptoms that I mentioned, go and quickly do your tests. Early detection is going to definitely prevent the further complications. If you're a diabetic, make sure you visit a diabetologist and take the expert advice and get yourself treated. Stay fit, stay active, stay healthy.
So thank you, Neha. Thank you so much for sharing your valuable insight on this podcast. And make sure you guys are connected with us for many other podcasts. And thank you so much, Neha.
Thanks, Bhavesh. It was really great being on this podcast, and I had a lot of fun. As much as you all enjoy, making sure that you'll grasp a lot from this podcast.
Thank you.
Thank you.